Welcome to One-on-One, the Daily Items weekly digital program featuring Susquehanna Valley newsmakers interviewed by Daily Item reporters. Today's guest is Family Practice CEO Al Lagerman, interviewed by reporter Marcia Moore.
It's cloaked in stunning designer attire, a statement of fashion from every angle, unashamed of its opulence, but nothing you didn't already expect from Lincoln.
Right now, lease the 2018 Lincoln MKZ for $440 a month for 36 months, zero due at signing. Or lease the 2018 Lincoln MKX for just $480 a month for 36 months, zero due at signing.
Sunbury Motors Lincoln, run by the Mertz family since 1915.
Welcome to the Daily Items One-on-One. I'm Marcia Moore, and today we're talking with Al Lagerman, the CEO of Family Practice Center. Thanks for being here, Al.
Thank you for having me.
Give me a little bit about what's going on with the Family Practice Center.
Well, Family Practice Center, we've started in, like I said, early on in 1973, Dr. Fasano was a solo doc, and he was a very entrepreneurial type person, and so we were able to grow the practice through bringing multiple clinics and physicians.
Where did it start?
It started in Mifflinburg, and he soon realized that it was harder and harder to practice by yourself. And so we've been very fortunate to be able to bring on multiple partners, either through, having a solo doc wanting not to be by himself or herself anymore, and joining our practice. And we've grown from when I started the practice in 1991. We had a total of, I think at that time, 5 practices, and now we've grown to 40. And
where are you located?
We're spanning 13 counties in Pennsylvania. It follows the Susquehanna, so it's purposeful that we've done that. We follow from as far up north as Williamsport, and it follows all the way down to York. So we have multiple practices in each what we call our regions, which are the northern region, Williamsport, Central, Schmoke and Dam, Selinsgrove area, and then our southern regions, Harrisburg, York area.
Where are you based now?
Well, so our administrative office is in the central region in Schmoke and Dam, but all our clinics, like I said, we have an even split between all of them. So we administer the practice for our physicians. They take care of patients, see them, take care of them, deal with the day-to-day problems people have and keeping their health where it needs to be. And we deal with the business side of trying to take care of their practice for them, doing their billing, hiring their people, making sure that we're being compliant with all the rules and regulation it takes to run a practice.
There's been a recent, announcement of what the planned expansion for the Family Practice Center. Can you talk about that?
Yeah, we've really worked hard over the last, I'm going to say 5 to probably more than that, 10 years. We knew healthcare was heading in a direction that was a little different than what we were used to, which was we take care of people and we get paid for taking care of them. And at what we realized, it was going to move to more that we had to be more accountable for the care that we were giving, quality wise, and also for the cost of it. And so, as you probably have seen or in the paper and know, the government's doing more and more with trying to get control of cost and quality. And so we early on knew that we had to do something, and we've worked really hard at getting our quality where it's above the standards. And we're now working on dealing with the cost side of it, which is you need to have some options for patients that are not all hospital-related options. And hospitals need to, they're busy places, have to take care of sick people. They need to have some of the costs be higher, but this is looking for helping to people that maybe don't need the high end, heart surgery or something like that, but can be dealt with in a little more cost effective way of doing it.
Well, let's talk about what you're planning for the former Sears location in the Susquehanna Valley Mall. How did that come to be, and what do you hope to bring there? So
through our research, we've learned that there are many smaller hospitals. When I say smaller, 10 to 20 bed hospitals popping up all over Pennsylvania. Mainly, we did a lot of research down in the Philly area, spent a lot of time reviewing, walking through, talking to doctors and hospitals that were running them, and working on a plan to say, is this something our community could use? And what we came quickly to realize, we think it's something our community needs. Our ERs we have great hospitals, our ERs are busy all the time, and it's just another avenue for patients to get care that that they need a little closer to home, and on top of it, be able to be taken care of, I think, in a little bit more cost-effective manner.
So what do the plans include for that space?
So there'll be ER, 24/7 ER.
Okay.
So patients will be evaluated. Certainly, we'll have to have the ability to be able to move people quickly to another avenue if something would there would be something major that we come to realize. But a clinical decision unit is evaluating patients and taking care of them that may need like a 1 or 2 day stay in a hospital.
Okay.
And with that, you need to have full X-ray. You need to have full lab. We're talking about doing some more community outreach. We think we want to help our patients get counseling on different things that they would need, like diabetes training and just dealing with their health education. So we're trying to partner ourselves with some health insurance plans. There are many of these down in the Harrisburg area where community can come and access. Sit down with someone, talk about, hey, I really don't understand what's causing my sugars to go up or go down. And they have people that are available to help them walk through and take care of those things. And they do a lot of group sessions. We're going to put an auditorium in, some group lectures, and some different things to help patients with different disease processes or just wellness type conversations. So there's lots of plans on both the emergency side, but also some wellness stuff and just taking care of people. And there's also been some talk about, expansion of more physician offices, getting more physicians, let's say, away from the hospital setting and get them into the community where they can be, people don't have to travel all over the place or to big hospitals to figure out how to get to them. They're right in their community.
Who would this serve?
Well, it's going to serve anybody in our community. So if you look at the primary service area, Selinsgrove, Shamokin Dam, Lewisburg, Herndon, it spans up and down the river as far as we're concerned, and it's mainly meant for our patients, the family practice center patients, but anyone can use it. I mean, it's going to be one of those things I think that the community will adapt to and do well with.
Why did you choose that particular location?
We thought it was just the best central spot. It's a half hour from Danville. It's 20 minutes from Evan. It's 45 minutes from Harrisburg. It's just the perfect spot, we think, to give a little bit more outreach to I won't say the rural areas of Pennsylvania, but a little lesser populous areas. And we think, basically, I think there's a need. I mean, patients are driving a good ways from their homes to get stuff taken care of, which we don't think they have to.
You've purchased the building.
We have.
You don't own the land.
We don't own the land. We rent the land. And so that concept is something that our physicians and our group has always wanted to do. We own our properties because it gives us a little bit more flexibility. We're not dealing with landlords to make decisions if we need to make a change to make things better or to do things differently. We're able to do it pretty quickly, and it's worked out very well.
When are you going to start actually renovating?
Actually, I started this week. So I have the full design for the lab, and so now I'm trying to get that. We'll get that to a blueprint and get it to Code's office at Monroe and down at our township, and we'll get basically approval, and we'll start. We're hoping to start within 3 to 6 months with that.
Okay.
We also have developed the physician clinic, and we're in the process of doing the wellness clinic.
Okay, well, we're going to take a little break, and then we'll come back and talk a little bit more
Sounds good.
about the project. Thank you.
It's cloaked in stunning designer attire, a statement of fashion from every angle, unashamed of its opulence, but nothing you didn't already expect from Lincoln.
Right now, lease the 2018 Lincoln MKZ for $440 a month for 36 months, zero due at signing. Or lease the 2018 Lincoln MKX for just $480 a month for 36 months, zero due at signing.
Sunbury Motors Lincoln, run by the Mertz family since 1915.
Hi, we're back with Al Lagerman from the Family Practice Center. We were talking about the new clinic that's going to be going into the Susquehanna Valley Mall, that former Sears location. Let's talk a little bit more about how it will work and why you think that this is a good expansion for the area and for the center.
Well, we've noted a lot of our patients, and we run our clinics from 7 till 7 at night, and a lot of times testing shuts down between 5 and later, unless you could go to an emergency room or a hospital. And so we decided that our patients, get sick at 5 and get sick at 7, and so we want to know, rather than send them home and be concerned that they're got a major problem. We just want to rule out that there is a major problem. And this facility will give us the testing necessary, either to do a chest x-ray to make sure you don't have pneumonia, or to do a cardiac test to make sure you're not having active problems with your heart. We'll do the testing there and be able to rule out, do they need to be admitted, and do we need to get them to a place that they can get taken care of the proper way? Or can we just do it here and get them on antibiotics and maybe keep them overnight and get them back home tomorrow morning? It's just a better way of getting people in and out of the system. And I think the hospitals that we're talking to and working with all get that. They really, I think, are working hard to deliver this type of care a little differently than they have in the past. And I think I'm excited, and I think they're excited. So,
are you hoping to partner with?
We're hoping to find a hospital system. We have multiple systems that we work with that span up and down to Susquehanna. They all are eagerly evaluating it, and a lot of process. They have to deal with a lot more regulation than a physician clinic does, and so they've done a lot of work. They're doing a lot of work on just making sure that all the things that need to be there can be there, and the services are what they need to make this thing work. So,
when do you expect it to open?
We expect the clinic to open probably not till 2 years, until we get all the planning and all the different things that have to be proved and done, and the build out of it. It's going to take up to 2 years, we think. So
Who's staffing? Who's going to be staffing?
So if we partner with the hospital, they'll be responsible for the operations of that particular clinical decision unit. So we will just be a part owner of the building and working with them to deliver that type of care. But they'll do most of they'll do all the heavy lifting when it comes to the people they hire and who's going to run it and the physicians that staff it. And we'll certainly try to help them with our physicians and supplementing it. But it's going to be on the hospitals. And again, we've had real great conversations with all the people that are interested.
Okay. Tell me a little bit about the center. Who owns it and who are they? And
So Family Practice Center is the biggest physician-owned medical group in Pennsylvania. We've been to several conferences, and we finally have realized that there are very few physician-owned practices. So most physicians work for either a hospital system or work for a for-profit entity, hospital system. And so the family practice centers are owned by the physicians that actually staff the clinics. And they make all the clinical decisions and all the business decisions of how the practice runs. And it's a great model because doctors are not focused on the dollars as per se. They're more concerned at times at how their patients are going to be taken care of. And we've got a good balance between the doctors who really look out for their patients and making sure we're not cutting things short on certain things. And so it's a good mix. So we've owned by the physicians, run by the physicians, decisions by the physicians. There are no other business people. There are no other administrators. It's all licensed physicians that own our practice.
how many are involved?
There are 57 owners, and we have 87 physicians. So there's 30 physicians that are employed. And the goal always is when we employ a physician, have them be an owner. We think we get the best out of that physician because they take a vested interest because they're working for themselves. And
so when this conversation about opening up this wellness in the lab in Selinsgrove or at the mall, when that came, how did that? When you have that many people that own are invested in it, how does the conversation start?
So it started with the population health.
Okay.
We need to move to a different model.
Right.
We need to get ourselves to a point where we're being able to demonstrate the higher quality and the lower cost.
Right.
And with it, we need the mechanisms to do it. And they're all in on it. They want this for their patients.
Right.
They want their patients having choices, and they want their patients being able to get taken care of at a level that they need to be taken care of and be able to afford to pay for it. I think that's the key that we're really looking to do here.
You're excited about this?
Very excited. Like I said, it's always a little nervous. You get a little nervous about it because there's lots of money being spent and lots of time being done. But at the end of the day, I think it's the best thing for our practice and the best thing for the community.
Okay, well, thank you so much for
No
your
problem.
time.
No problem.
Thank you for watching One on One. We hope you will join us this coming Thursday at noon for a new installment.